webinar series. I'm Hala Ali, the coordinator for Easter Alliance for Global Health Partnerships. And these webinars take place on Fridays at 12 p.m. GMT. And every week we host experts from healthcare and global health fields to discuss various aspects of the COVID-19 pandemic. We are delighted to co-organize this webinar with the Irish Doctors for Environment. IDE is a group of healthcare professionals in Ireland who believe that the climate crisis is a health crisis and that as clinicians have a responsibility to their patients and to our planet to act on this. IDE is active on issues such as healthcare waste, education, green prescribing, and air quality. You can visit their websites posted to the chat box for more information. Today's webinar is exploring a planetary health response to the COVID-19 pandemic. For anybody who wants to get an e-certificate, please email request 1 to info@globalhealth.ie. A recording of this webinar will be available in our websites and YouTube channels shown on the screen, Irish Global Health Network and Easter Alliance for Global Health Partnerships. Live streaming is also available right now on our YouTube channel, Irish Global Health Network. If you have any questions during the webinar, please use the question and answer feature in the bottom of the screen. Today, we are very excited to welcome our moderator, Rosie James, IGHN board member and a medical student in National University of Ireland, Galway, who is currently also pursuing a master in global health at Maastricht University. For now, I will hand it over to Rosie James to introduce the speakers and lead the panel discussions. Welcome, Rosie.
Hi, thanks, Hala. I'm so pleased to be moderating today what I think is a really important discussion to be had surrounding global health, but also the health of our environment. Unfortunately, our co-host from Irish Doctors for the Environment, Dr. Saifli, can't be here today because she's working on the wards. But I'm not a planetary health expert myself per se, although I've come to learn throughout my studies in medicine and global health that there is no health without collective multidisciplinary responsibility for our environment. I believe that how we interact affects our environment, as we've seen during this pandemic, and vice versa. The environment affects our health, both our physical health and our mental health. I'm sorry I'm not Greta Thunberg, but as a young person, I hope I can speak on behalf of our future generation and the young health workforce that we urge for this planetary health movement to be taken seriously, especially now in the context of COVID. We should be looking to see how we can best move forward and achieve planetary health for all together. So I would like to introduce our speakers. First, we have Renzo Guinto. He's a Filipino physician and Chief Planetary Health Doctor at the Planetary Health Lab. He holds a Doctor of Public Health degree from Harvard, where he investigated climate health systems in the coastal Philippines. He's a member of the Lancet Planetary Health Editorial Board and co-founder of the Emerging Scholars Network for the Planetary Health Alliance. He served as a visiting fellow in Antwerp and as a consultant for the World Bank, WHO, International Organization for Migration, and the Philippines Department of Health. After Renzo, we'll have Tara Shine. She's a Doctor of Environmental Science based in County Cork. He's been working for the past 20 years as a climate change negotiator and advisor for environmental policy before setting up Change for Degrees, which is a sustainability consultancy based in Cork. He's also the author of the book, How to Save Your Planet, One Object at a Time, science communicator and TV presenter. She's now the incoming chair of the board of the International Institute for Environment and Development. After Tara, we'll have Lanvin Confieso, a friend of mine from the World Resources Institute, India. He's based in Mangalore right now, which is not far from me in India. He's focusing on energy development for Indian states that are vulnerable to the impacts of climate change. He's previously worked as a consultant with the Food and Agriculture Association and at the United Nations Development Programme. He holds a master's in renewable energy from the University of Strathclyde, and today he'll be sharing an interesting case study about how he's solar powering a hospital in rural India to respond to the pandemic. And last but not least, we have Aoife Kirk. She's a doctor in Dublin, supporting the HSE public health team for the pandemic. She holds a master in public health from the London School of Hygiene and Tropical Medicine. And she co-founded Irish Doctors for the Environment in 2018. She's also on the Wonka Working Party for the Environment, which works to create planetary health education content for primary health doctors worldwide. And she'll be giving us a more clinical perspective to the planetary health movement. So with that, I would like to say, Renzo, go ahead and enlighten us. Thank you.
Thank you very much, Rosie, and good evening from Manila, Philippines. Good day to our friends from Ireland and to the others who are listening right now from different parts of the world. I'm really thrilled to be part of this conversation. And you know, first and foremost, I just want to remember and honor the nearly 7.5 million people that have already been affected by COVID-19 globally. And I actually just recently looked at the numbers. Both the Philippines and Ireland have already reached around 25,000 people being affected by this pandemic. Of course, we also remember not just the ones who got sick, but also the frontliners that are really protecting our communities right now as we try to combat this epidemic. Again, I'm thrilled to be part of this conversation. And, you know, as a Filipino, we're always described as the Irish of Asia, because both Ireland and the Philippines are countries of the diaspora. You know, we've migrated to so many places, and we've brought Christianity to so many parts of the world. And so, you know, it's great to be having this conversation. Maybe it's the Irish who are the Filipinos of Europe, right? And actually, you know, another trivia, the national hero of the Philippines, who is a physician, Dr. Jose Rizal, who led the revolution against Spain, you know, more than 100 years ago. He actually was married to an Irish lady. But I am not insinuating that I should be looking for my own Irish partner, maybe, who knows. But I believe that we can partner, both Ireland and the Philippines, in trying to protect both the health of people and the planet. And then finally, today, actually, we're celebrating the Independence Day of our country, the Philippines, right? And so, you know, more than a century ago, we were liberated from the manacles of colonialism. But I think today, there is another form of colonialism that we're trying to fight, and that is the colonialism of humanity over nature. And I think that is the very spirit of the term and the concept planetary health. Planetary health, and I'm not sure how exposed our audience today to this new term, to this new concept. It is, you know, more than a discipline, more than a field. For me, it's really an integrated vision for the future health of both people and the planet. And we know that over the past century, the field where probably most of us do belong, the field of public health, has added 25 years to the average life expectancy of the world. Of course, not evenly distributed across populations. Nonetheless, we've added, and you know, we've achieved enormous gains in health, in child health, maternal health, nutrition, etc. But unfortunately, at the expense of the planet, we've created economies that brought prosperity and wealth to many places. You know, food systems that put food on our tables, healthcare systems even that made sure that we get to treat some of the world's pressing ills. But unfortunately, again, because the Earth, the planet, was not taken into account in all these human activities, then now we are seeing massive global environmental change happening right in front of our very eyes. And then in turn, introduces new health risks and problems and disease. Take, for example, climate change, which has been described a few years ago, more than a decade ago, by the Lancet as the greatest global health threat of the 21st century. And you know, right now we're fighting COVID, which has been described by Bill Gates as a once-in-a-century pandemic. But I think in this century, there's an equally important challenge, if not more, an existential crisis that we are facing and about to experience if we do not do climate action now. You know, it doesn't mean that because there's COVID-19, climate change actually has stopped. Unfortunately, it hasn't. And yes, in recent months, there have been a lot of reports about, you know, even in Manila, which is a city that has high levels of air pollution. Now we see bluer skies, and you know the air is much more breathable. I remember in Venice there was even fake news saying that dolphins have suddenly showed up in the canals of that city. But one thing, you know, one word of caution that I want to give, and that is, we have to not, you know, we cannot romanticize all these, you know, initial temporary environmental benefits that we are so far seeing as a result of the economic shutdowns and the societal lockdowns. There was actually one study very recently published in Nature showing that for the past 3 months, there has been a huge dip in carbon emissions. We've actually achieved 2010 levels just because we've closed the economy and we stopped driving cars, and coal power plants in many parts of the world had been shut down. And so there's some degree of decarbonization that has occurred. But again, word of caution, this is not the type of decarbonization that we want. We don't want decarbonization through the means of a pandemic that kills lives, disrupts healthcare systems, and disturbs society at large. What we want is decarbonization that is intentional, gradual, planned, taking into account all these side effects. You know, we know that there will always be populations that will be affected by such massive reforms. But again, if these considerations are already taken into account at the start, at the design stage, then we can ensure that we can achieve our goals for environmental protection, but at the same time protect the health and well-being of the people, especially the poor, the vulnerable, and the marginalized. You know, I want to have more time for us to actually have a robust and vigorous discussion about all these pressing issues. And so I'll just give a few more points to conclude my opening remarks. You know, planetary health really gives us an opportunity to upend our traditional way of thinking about health. And before, as I've said, it's always about health of people, you know, the traditional anthropocentric view of health. It's all about us. And planetary health is again telling us to break away, you know, from that kind of mentality. There's even one term that I want to introduce, from an ecological approach, meaning it's all about us, right, to a more ecological approach. And when you say it's an ecological approach, there's multi-species consciousness. It's not just about humans, but it's also about creatures great and small, the microorganisms that ensure the great biodiversity that in turn enhances our health and well-being. It's also about the abiotic factors, right? Land use change is a major problem in this day and age. We've turned every forest into a city, a subdivision, or even a golf course. And that is disrupting the natural life basically of our planet, which again in turn affects us, humanity. And finally, I think the health sector, we are in a great position now to take the lead in climate action, to take the lead in this planetary transformation that needs to happen. The health sector has always enjoyed a very high level of credibility, right? We are always seen as a pedestal in society since ancient times. In fact, not just the doctors, but more so the nurses. For the past 18 years, the nurses have been deemed the most trusted profession of all, with physicians like some of us coming, second. And then now, because of COVID-19, we've seen images of frontliners being even described as heroes, when in fact we're just doing what we're supposed to do as part of our responsibility as healthcare professionals. But now is the time, and we are given this moment to really amplify our voice, raise, sound the alarm. There's a bigger crisis that is looming, and if we don't act now and we don't use this economic pause, this transition phase that we're having, in order to shape a better alternative post-COVID future, then we will be, it will be a waste of this opportunity. So I hope this conversation will be an opportunity for great ideas for the health of people and planet to blossom. Thank you, and looking forward to a great conversation.
Angela, that was really, really nice. So just one question, as an academic, where do you think lies the research gap at the moment for planetary health? Or do we already have enough research, and is it more to do with getting policymakers to implement these changes?
Great, and I actually call myself a pracademic, where you actually combine theory and practice. There's an intentional, there's an intent to really translate evidence to action, to policy and practice. And basically you answered the question. There's enough knowledge, right, that we have about what's happening in the environment and its linkages to human health. And we cannot wait for another clinical trial or another evidence synthesis to again just, remind the global community, our leaders, our politicians, that we need, that business as usual has to stop. And that's why a lot of the gap really is in the no-do gap, right? We already know a lot of things about these problems. It has taken us 21 climate negotiations to come up with the Paris Agreement, right? That is like, that is just lack of really deep concern and care for people and planet. If you've taken that long to come up with a not so ambitious agreement, to be frank, right? It's not the ideal agreement that we wanted. And so we have to, we cannot repeat the same mistake again. And hopefully this is the opportunity to make things right. Thanks.
Thanks. Okay, so I'll hand over now to Dr. Tara Shine in Cork. Take it away, Tara.
Thank you, and thank you, Renzo. I have to admit that I am one of those negotiators that sat in those rooms for some of those 21 sessions, far too many of those 21 sessions that led to the Paris Agreement. And it is slow and it is cumbersome, but at least it brings the whole world together in whatever we agree. And I agree that for me, one of the most important things about the COVID-19 pandemic is that we use it as an opportunity for change. For me, the biggest failure is that we go back to things exactly as they were. If we don't use this opportunity to learn and change how we live on planet Earth, to be more humble, as you say, as just one species living on this planet, to not think that we are in control and controlling of everything. I see someone, as mentioned, Kate Raworth's donut economics, things like that matched up with the work that you're doing in the Lancet Commission, but this integrated approach that you speak to as well, to me, that is the heart of what we need to do, and we need more of that, absolutely. Just from my perspective, and I'm an environmental scientist, I don't have any kind of a medical background. It is all around trying to make these connections between us as humanity and the planet and all the other species that we share the biosphere with. Johan Rockström, who is one of these people who leads the work on planetary health, has said, if we are serious about our human well-being, from local communities to the global world economy, we need to now reconnect our entire world to the planet. And that means it means the entire world. It means how we do business. It means our economic systems. It means our social systems. It means our value systems. All of these things need to be reconnected to how and where we fit in this planet. That also makes me think about, obviously, the risks that we face and how we can be resilient. And what strikes me is that at the beginning of this year, when the World Economic Forum looked at the risks facing humanity, the top 5 risks there all relate to the environment. They're things like extreme weather, climate action failure, biodiversity loss, environmental disasters. In fact, contagious disease, infectious disease doesn't even figure in the top 10, yet it is the risk that has overwhelmed us, if you like, or nearly overwhelmed us this year, certainly had a big impact on us. But what we all know, and which there are any number of crazy little cartoons out there that show, is that whilst we're focused on this wave and getting the pandemic under control, there is a bigger wave waiting for us, and that is the wave caused by our planetary ill health, climate change and biodiversity loss, and that's what we need to plan for next. So there are obviously lots of links between COVID and the climate change, COVID and our environment. And so those I'd like to talk about are air pollution in particular, the fact that the most vulnerable people are always at risk, whether it's COVID or climate, the shrinking space we have for our biodiversity and how that links to the spread of infectious disease, and some benefits of COVID for the planet and some risks to the planet from COVID. Many of you will know better than me about the impacts of air pollution on people's health. And what we're learning now from COVID is that the places which have the highest incidence of air pollution were the places with the highest incidence of COVID-19. And what compounds that statistic is the shocking fact that most minorities, most marginalized people live in the parts of our planet with the dirtiest air. Therefore, they are exposed already to greater risk of respiratory and other diseases, which made them then more vulnerable to the coronavirus. And so tackling air pollution has long been at the heart of the links between human health and climate change, human health and the health of our planet. Yet it's one that we still struggle to deal with. So in Ireland, you know, over 1,000 people a year die from air pollution related deaths. It's 40,000 a year in the UK. It's millions when we go to a planetary scale. So this is something we're going to have to look at, how we clean up the air to protect people's health now, but also to make them less vulnerable to viruses like COVID. Who is most vulnerable? Of course, again, it's always the same people. It doesn't matter if it's COVID or climate, women and children are most vulnerable. People living in poverty, people who are homeless are vulnerable. People with underlying health conditions, and those are often linked to poverty, are most vulnerable. People working in the informal economy without work or working in unskilled jobs, migrants and migrant workers, refugees and asylum seekers. This is the climate justice part of both climate and COVID, which is that it's always the same people who are most vulnerable. And focusing our planetary response, our human response to that in a way that's fair and just is going to be really important. Because climate change has already been killing us. It's already been killing us through heat waves like that in France, which killed over almost 1,500 people in 1 year. It is killing, you know, through air pollution, almost 600,000 children each year, mostly from pneumonia. So we know that the ill health of the planet is already contributing to our ill health. So now is our chance to act on that. The shrinking space for nature has also been pointed out as a problem we need to address. The Secretary General of the United Nations has said COVID-19, which emanated from the wild, has shown how human health is intimately connected with our relationship to the natural world. As we encroach on nature and deplete vital habitats, we increase the number of species that are at risk. And this includes humanity in the future we want. So we know that as we humans take over more of the planet, we cause habitats and species to become less well, to become sick because they don't have all the resources they need to live. And we increase the interactions between humans and wildlife. And what this means is that the US Centers for Disease Control and Prevention has found that 3/4 of new or emerging diseases that infect humans originate in animals. And this has obviously been a big part of the conversation around COVID about its transmission from humans to animals, or from animals to humans. But there have been amazing benefits of our response to COVID for the planet. The lockdown has meant no air travel, less congestion, more people on bikes, more peace and quiet a greater connection to nature for many of us, a slower pace of life, more physical activity as we walked our cycles to get places instead of jumping in the car. And as has already been said, that will lead to a fall in our emissions for this year, possibly by 8%. But this is not the way to reduce emissions. This is not a just or sustainable approach to achieving our goal of zero emissions by 2050. We have to actually change policies and systems to do that. Some of the negatives from the COVID pandemic for the environment are around waste. I think there's been a great resurgence in single-use plastics and plastic packaging, and you can all tell me a lot more about the extent of the use of disposable items like PPE in the healthcare sector. Massive volumes of waste. Are they essential? Are there other ways in terms of reusables and washing that we could reduce that volume of waste? And then we need to think about how we shape our recovery, and there are opportunities and risks there. As we invest billions and billions of dollars and euros in fiscal stimulus to help us all recover, we can either go the route of countries like Germany, Korea, and New Zealand and make that recovery a green and sustainable recovery, investing in green jobs, in electric vehicles, for example. Or we can invest that recovery money in fossil fuel and high carbon industries, which will not change anything, and we will not go back to the way we were. So the EU is giving strong leadership on this, and they're matching very closely their Green New Deal with our COVID recovery plans. In Ireland, we're trying to form a government, and these issues are right at the heart of the conversation. But nevertheless, there's a risk that almost 500 billion euros at the moment risks being invested in the wrong thing, in high carbon recovery rather than a green recovery. So I want to see us keep the opportunities, keep the good things that we've learned from COVID. I want us to keep the clean air. I want us to keep uncongested streets, unpolluted streets where people can move freely and they feel safe to cycle and walk rather than go in their car. That by traveling, by moving, people get healthier and fitter. And I'm really interested, and I would love to hear from you all, in rethinking medical best practice. Does medical best practice have to be so reliant on disposable single-use items? I'd love to hear from you on that. And yes, we know that the next wave facing us and will make COVID seem perhaps even small is the climate crisis. And the curve we now need to flatten is the curve of our emissions to bring them down below 1.5 degrees, which is the only safe threshold. So that leaves us less than 0.5 degree of warming that we can sustain to keep our planet healthy. But I do think we have a real opportunity to turn the recovery into an opportunity to improve our planetary health. And if we don't, I amongst many of you will be very cross with us all in the world. Thank you.
Very good points. Can you just give us a very brief idea of what happened in Cork with the ban of coal burning? I think last year there was some success with that. And who was involved with that? Is it mostly government, or is there any role for civil society?
So in Ireland, we have a smoky coal ban in our cities for the last few years, but it only covers our cities, our major centres of population. And it has reduced smog in our cities, where in Ireland we still burn a lot of solid fuel as a form of heat. In the Midlands of Ireland, up to 40% of houses are heated by burning peat, by burning turf, which is crazy from an environmental perspective and crazy from a health perspective. But we haven't yet. We have a draft clean air strategy in Ireland, which is sitting on a shelf for a few years, not yet enacted. Anyone from government listening, when you get in, number one thing, just pass that act. Which would mean, I think, really that we need to go beyond what we have now. So it's not even extending a smoky coal ban to all of Ireland. It's actually saying we're not going to burn any more fossil fuels in Ireland. So no more coal, no more turf. And if we burn anything, that must be wood, and it must be dry wood. That's still particulate matter from wood. It's not perfect. But short of like causing cultural mayhem and not allowing people to have any open fires anymore, that's one way. And then the biggest thing that we're doing right now is like not driving our cars. So all of that particulate matter that comes out of our diesel engines has not been in circulation in recent months. And if we could find a way to keep that through scaling up and accelerating the transition to electric cars, that would be amazing.
Okay, so now over to Landon from India.
Hi, Rosie. Let me try and share my screen as well, and hope you can see it. Let me know when it's... Okay, great.
You can put it in full, yeah, perfect.
Yeah, okay, yeah, it's great. It's a pleasure to be part of such an inspiring group of speakers here and to, bring the point of view of an energy practitioner to this webinar. So I'm part of the energy program at the World Resource Institute in India, and we've been working on the need for creating reliable infrastructure for ensuring resilient healthcare, and the need for which is now obviously enhanced with the ongoing pandemic. So, I mean, just to speak of from the context of India, household electrification has gone up quite a bit significantly in the past few years, but access to electricity is far worse off at the institutional level, especially in the health, education, and livelihood sector. So we've been working with states in India, with both government as well as non-governmental organizations to show how improved electricity access can catalyze socioeconomic development. Again, when it comes to healthcare, electricity is required all across the spectrum of operations, from diagnostics to ventilation, to water sanitation, creating cold chains to store vaccines, as well as to create a conducive environment for staff as well as patients. So yeah, I mean, yeah, like you had mentioned in your introduction, just to present an example of a hospital that has shown a positive outcome out of better access to electricity. This is Navjeevan Hospital in the state of Jharkhand in Eastern India. And it serves two of the most underdeveloped districts of the state, with the nearest next hospital nearly 120 kilometers away, and that is the state capital. This hospital was only the second hospital to get a tuberculosis unit, and now provides free TB treatment to nearly 700,000 people for free. So yeah, it does, I mean, like I said, does play a vital role, but with very limited support services. For the first 20 years of its operation, it ran without any electricity and had to conduct deliveries and operations using torchlights and kerosene lamps. When they did get an electric connection, they still reported outages of 3 to 8 hours a day. So unable to meet this energy demand, they had to purchase an expensive diesel generator and have to spend nearly $3,000 a month on electricity and fuel purchases. So that has obviously impacted its potential to provide service delivery, in terms of the fact that critical hospital equipment cannot run well during outages, as well as creating safety concerns and difficulty to retain staff. So now, yeah, I mean, in India, we've reached nearly 300,000 confirmed cases. And so in early April, this hospital was designated as a dedicated COVID-19 hospital. And yeah, so in the situation, it now has to cater to nearly 450 villages in the district with a population of 2 million people. So just to put things into perspective, this is a 100-bedded hospital catering for nearly 2 million people. And the main question was, were they equipped to deal with the situation? And that's when we'd like to say, how renewable energy sort of came to the rescue. So just last Christmas, incidentally, they got a grant that allowed them to install a 10 kilowatt peak solar PV system on the rooftop. And now at the front line, this hospital is reserved only for moderate and severe cases, when most of the milder cases are shifted to government hospitals. And in the case of why it's reserved is because now it has an energy or a solar PV system that provides power to a fully functional sets of ICU beds and ventilators, and also meets the other critical needs. But of course, the challenge still remains. When we had initially sized the solar PV system, we wanted a much larger system that could provide to all of the facilities that the health clinic provides. However, due to lack of finances, that was not, we were not able to achieve that. And yeah, this situation is sort of prevalent all across India. This is the pyramid or the structure of hospitals, especially in the rural India, starting from sub-centers at the very bottom up to district hospitals at the very top. And if you see the number on the right, which says that, the number of sub-centers and primary health centers that do not have access to electricity, that translates to nearly 24 million people who still access healthcare in clinics that do not have any electricity. So yeah, I mean, in terms of challenges, challenges have primarily been due to the lack of an integrated approach across 4 themes. This policy where the local context is not taken into consideration. There has been a lack of financing until now, at least, in the healthcare space. Technology is available and is economical, but the right technology selection and system sizing is still not up to the mark. And lastly, data on different policies, on financing options, and technology selection, as well as data for government officials as well as other institutions to really realize what the potential for electrification of healthcare really is. And we have sort of been working on this front, on how we can integrate the various development outcomes from electricity to health. So this is just a map of Jharkhand, and what is highlighted is the various districts. So not just do these maps allow you to map out, health indicators like maternal deaths or infant deaths, but it also allows you to show which of the healthcare centers are not electrified, what kind of infrastructure is present in terms of road networks, etc. So this whole integration is primarily to ensure that any user can identify target geographies and the energy access potential in these, and these can then be linked back to to development outcomes, and depending on how the user wants to showcase it. So yeah, I mean, just to sort of summarize into more slides, the poor healthcare, the pandemic has exposed the poor healthcare infrastructure, not just in India, but even across developed countries. We are working to show how improved energy access can ensure service delivery, not just in normal days, but during pandemics, as well as climatic events and natural disasters. So yeah, the problem of Navjeevan Hospital is still not solved. Like I said, there's a need for a bigger system, but unless there's a focused effort by governments, non-profits, NGOs, research institutions working in the health space, the likes of Navjeevan will still continue to struggle in the dark. So yeah, that's all from my side. Thanks.
It's a really close topic to my heart. I was in rural Uganda, sort of similar setup, and I saw many pediatric patients die just because the hospital didn't have power to fuel oxygen. So it's a really crucial issue. What do you think it would take for your approach to be implemented in other countries around the world?
Right. I mean, so this approach needs to be tailored, right? We can't assume a one-size-fits-all approach for any country. So this, and again, having said that, this has to be a bottom-up approach. We need to understand the challenges on the ground, especially, and also the local contexts. What is missing now is really estimating the energy demand, not of the whole sector, but of individual hospitals. What is the unmet and undermet demand, and also what is the future demand? Because any solution we provide now has to be sustainable over 20, 25 years. So how do you then estimate what is the future demand in terms of number of beds that this hospital might add, number of new wards that a hospital may add as well to it. Apart from that, there's also need to identify the right technology solutions as well as financing options, and implement these solutions not just as one-off pilots, but to ensure that this sort of, not business, but delivery model can then be scaled. And that can only be done by continuously monitoring and evaluating the impacts of what your solution has had, both positive and negative, and then ensure that this actually feeds into policy discussions.
Thanks, Anvin. We have a question from the audience. How a solution is provided to the same needs to be elaborated. So I guess you just sort of touched on that it needs to be scaled up and made sustainable. What sort of approach can you take there? Is it about getting government engagement or research?
Sure. The question is relevant. I mean, I think in the interest of time, I ran through it, but the thing is that in terms of the solution, elaborating the solution, the initial problem was that the hospital, was incurring a large cost on fuel and for diesel fuel, and how you can actually replace it. And now this solution has to vary from healthcare center to healthcare center. what is needed is to really estimate which tier of this hospital is in, to estimate what the actual energy demand is. So we have to actually go on the ground, know what equipment is there, what equipment will be needed in terms of, now you look at cold chain being relevant and how deep freezers or, your Iceland refrigerators might be added to this. So really estimating the actual demand, and then, as energy practitioners provide solutions. And, it should let's not end at, using a tool and providing a solution. I think that's being done constantly, but also the latter part of it, which vendors to approach, how do you procure the solution? What is the right technology fit? How do you ensure that operations and maintenance and the sustainability of systems actually taken into consideration right at the beginning? And so that is an approach which will change from hospital to hospital, but the underlying aspect is that it has to be a bottom-up approach.
And that's great. Now I'll hand over to Aoife Kirk. She's a doctor in Dublin and co-founder of Irish Doctors for the Environment.
Great, thank you so much. Can you hear me okay? Okay, great. Thanks, Rosie, for introduction, and everyone for your inputs. I won't take too long because I am excited to maybe have a bit of a discussion around between ourselves, bouncing ideas off. And I guess today, I'm usually used to using slides because I'm quite a visual learner, but today I'm going to give a bit more of a why I believe that doctors should be advocates for the environment, maybe a bit of background around my introduction to planetary health and what exactly it means as a doctor. And then maybe just having a chat about what we can do as both clinicians, but also as citizens of the world. And I think, as we keep mentioning, now more than ever, the COVID pandemic has really shown us not only what we can achieve, but also how quickly we can achieve things and how quickly policies can be put in place. And we really need to look at, people are talking about a second wave of COVID, but we really need to examine the longer term second wave, which is climate change, and the countries not only in the global north, but how the global south are adapting to it already. And we need to learn from that. We really need to start having these conversations with our colleagues in India, with our colleagues in the Philippines, because already these changes are happening, and how can we reduce our carbon emission, because it's the global north that is the issue around this. So I guess just a bit of background. I've always been really interested in the environment. I grew up in the west coast of Ireland, so I'm surrounded by storms year after year. So I think it's something that has always resonated with me, and I didn't really appreciate enough how much benefit I got from the environment until possibly until I started traveling around the world and recognizing every other culture's association with the environment. And when I started the master's, and this concept of planetary health as a framework, bringing together both the environment and health, really resonated with me, because I'd never really thought of it in that perspective. And it's something that I was then struck by the links, the co-benefits. So we're looking at global health, we're looking at health in Ireland, we're looking at health anywhere, and we're looking at non-communicable diseases, chronic diseases, all these issues that are coming into our emergency departments, and how can we prevent those? And that encompasses looking at what we talk about in planetary health. So how do we then look at transport? How do we look at housing? How do we prevent the inequalities that are so systemic? And I think we need to pay tribute as well to the movement that's going on in the US and across the world, and the solidarity that we're now seeing in communities. And this has come from systemic injustice, which is throughout. And really planetary health does give us that overall lens, which is something that we need to look at from both bottom up action and also top down action. So yeah, so after being introduced to the framework and a very powerful lecture from Andy Haynes in LSHTM, and also from numerous other lecturers who described climate change as one of the biggest global health threats, which it is. So I became more interested in maybe how can I help as a medic, and where can I make a bit of a difference? And I think one of the biggest things, and one of my biggest takeaways, is so often with climate change and the conversation is it seems so large, and same often with COVID and pandemics, and it's very difficult for people to engage in it sometimes. But actually, if you break it down to, well, what can I do in my little community? How can I then engage? And it's similar in patient behavior change. How do you then move up the chain as such? So really surrounding yourself by people who have the tools to help, who are passionate about it. And I started reaching out to people, and we became, I guess in Ireland, it became a small group of us who've now expanded to, I'd say there's about 160 different doctors across Ireland. Really keen for anyone else who is interested to contact us. And it's a broad range of Irish Doctors for Environment. It's a group of us who really are interested in different aspects. And I think it's been a lot of peer learning. We're learning a lot from each other. We're educating ourselves, but also hoping to educate the public and starting to educate our patients. And also, I guess as clinicians, in particular myself and Renzo mentioned as well, like we're very action orientated. So it's like, well, how can we act on this? So how can we improve policies in our hospitals? How do we pressure politicians? How do we act as citizens? How do we create curriculums that enable medical students to learn about climate change? I came out of medical school not really having heard anything about climate change. So to realize that the Lancet called this the biggest global health threat 10 years ago was something that I knew at the back of my mind, but I'd never been taught. And it's really about how, so we're working across curriculum, hospital policies. We're trying to engage with policy at different levels, I guess, and that's often something that we can struggle as, because doctors are time poor. GP practices, how do we improve those? So it's really a whole range, and it's been quite special because it's across different specialties. So we're really collaborating on that level. I guess the other unique thing about Ireland, I can speak from experience, is our engagement with citizen activity. So over the last 10 years, there's been a number of different changes, and this has arisen from a lot of pressure from the bottom up, is what we call it, which has then implemented the top-down approach, which is in keeping with planetary health. So one example is the Citizen Assembly, which was held for climate change, and that implemented the pressure to then encompass an all-action climate plan, but we're very far behind the curve, and this really needs, it does need action from all fronts. And I think, as Renzo mentioned, healthcare have been, I mean, the frontline workers have been called heroes, which is really touching, I guess, but actually we're just doing our job. And what really, who really are the heroes are the communities who've come together to enable lockdown, which has been very difficult for so many. It's really highlighted the injustices. And I think in particular, what we need to do is act on the opportunities now. So we really do need long-term plans. We can't be thinking short-term for the next 2-3 years. We really need to be engaging in how do we create not only healthy environments, but actually sustainable healthcare systems that will manage the next shock, that we don't have to shut down the whole economy. How do we rebuild the economy so it is inclusive of nature as something that we're investing in? I think more and more we've really seen the appreciation that people have had for green space, but we're also looking at there's not a lot of access to green space, and that's a whole area in itself. So yeah, I've kind of gone on a bit of a roundabout there, but I guess I do have 3 points to make insofar as the first point is in the current climate that we're in, we're looking at two pandemics. We're looking at COVID-19, but we're also looking at racism, and we really need to examine both of those, and how do we look at these pandemics and emerge from them in a more communicable, wholesome, and less unjust, less inequity way. We also need to reflect on how we're rebuilding our economy. So how are we investing in the future? And we need to not only look at our own countries, but look beyond the borders. We need to examine who's doing this well, who isn't doing it so well. How do we learn from each other? And the third thing I would say is, like, as a medic and as a healthcare physician, we need to start listening and educating ourselves. And that's something that IDE have been trying to achieve. And it's been really humbling to have so many people speaking out on climate change. And I think a lot of that is around embracing our role as doctors for being a patient advocate. And that's not an unusual thing. We've looked at this with smoking. I know in the States there's been a lot of conversation around gun control. I know in the 80s, doctors across the world stood up against nuclear war. So it really is something that we need to come together as physicians, because we are a community, and we just need rapid and bold political action, as well as we need communities and citizens to understand that there may be changes. The changes may be difficult, but we do need these long-term issues.
Completely agree. Yeah, I encourage everybody to pop their questions into the chat box. We have a few from the audience about diet. It's quite topical at the moment, the link between diet and zoonotic diseases, and the link between diet and climate. So I open to the panel, who has any perspective on this. Should we all be eating a plant-based diet, or is this not feasible? What are the health benefits? What are the challenges surrounding this? And would it be applicable in all settings? Thank you.
Yeah. Can I answer that question?
Go ahead. Yeah, you're on the One Health Commission in Oslo, right? So I think you would have a good insight into
Right.
this.
I'm in the One Health Commission, but I'm also in the Planetary Health Alliance, and that can be confusing. And interestingly, it didn't, that question about what is planetary health, One Health, Eco Health, that did not show up. We can discuss that. It's another webinar in itself. But to answer the question on food, there's already a Lancet commission in 2019 that basically proposed this idea of a planetary health diet. Mainly, it's the diet that, preserves or protects the planetary boundaries, not overusing energy, land, water, not emitting carbon, but also provides the best amount of nutrition for people. So I invite you to visit or to Google the planetary health diet. But basically the message is we need to eat less meat and more plant-based products, right? And it's not just about the emissions to of carbon, the reductions in carbon emissions, or the reduction in the risk for zoonotic infections, but also it reduces our risk for cancer, because as we know, red meat has already been declared by the WHO as a carcinogen, right? Red meat and processed meat. And then the fourth benefit is it also reduces the risk of AMR, antimicrobial resistance, because we know that the misuse of antibiotics, 75%, comes not from human medicine, but because we've been pumping chickens, cattle, and livestock and pigs, right, with antibiotics as if they're vitamins. And so that is what I call a planetary health nexus solution. A solution that actually tackles not just one, not just two, but 4 problems. I'm sure there are much more at the same time. And so it will be interesting to identify those kinds of solutions, but we can only find those solutions if we physicians like Ipa and myself talk to other non-physicians, people from other disciplines like Lanvin and Tara. I always say health of both people and planet are so important to be left to the doctors alone. And really every sector is a health sector. Every ministry is a health ministry. That should be the mindset for the post-COVID future.
Completely agree there, yeah. Okay, another question. How, maybe perhaps Aoife would know this, how can we balance these anti-racism public demonstrations with public health? It's a tough question.
How can we balance them, is it?
The risks of public health transmission.
The risk of, so sorry, I don't really understand the question. So how can we balance having the conversation around it, is it? Well, I think health, if you look at any hospital, probably anywhere in the world, it's one of the more diverse areas, because we have, for example, many Filipinos, many people from the Middle East, and many people from Africa and all over. And I, for one, have been learning an awful lot over the last 2-3 weeks, and I would have considered myself one of the more educated people. I think that one of the things we need to do is to begin to listen and to begin to ask questions. And this also comes with climate change, is we often think we know, but we really don't know. So we really need to start being a bit, possibly a bit more humble and accepting of that. With regards to planetary health, one of the planetary health principles is around engaging in cultural, and I know, Renzo, we've had this discussion before around community, and a lot of that is embracing your own identity, and it's also how do you relate to nature, so that interlinks. So I mean, it's a really interesting, in-depth conversation that I don't think I can summarize in a minute or two, but I think I think it is something that we need to become more aware of with not only our language and our actions, but actually, I mean, I know Renzo's been involved, and I was at a talk before as well, and have been quite active in exploring the decolonization, and that is around listening. That is around actually what are the needs and how where are the community needs. So it's around looking at primary care, investing in a lot of different aspects of that. So I don't know if I really answered the question there. I think that's more, it's like an hour-long discussion then. Yeah. But I think it's important to address in the current climate that we all are.
Yeah, and there's another comment from the audience that we don't have time to go into, but it's an important remark to raise, that apart from poor air quality, there's also the issue of overcrowding and people living in migrant settings, overcrowded slums. That's also a huge problem for both the environment, but also transmission of diseases like COVID and TB.
Yeah.
So I'm sorry, we don't have much more time. Does anyone want to raise a final point?
Can I say one thing, Rosie? Thanks to everybody for those comments. Just to pick up a couple of things. The question asked about, you know, how do we deal with racism and climate and COVID, all these things at the same time? I think the SDGs are a fantastic framework for us to understand how all of these things are interlinked. We cannot tackle climate change if we don't tackle justice and inequality. The same applies for good health. We can't be healthy if we don't look at life in the seas and biodiversity. It's all interrelated, and they're a really strong way of helping people to understand that. And I think the other really powerful link between all of these things is human rights, and looking at human rights in terms of people's voice, their participation in the decisions that we make, in making sure that rights to food, water, livelihoods, shelter are met. They're another really powerful way for us to advocate for the kind of things that have been coming up in the questions. Thanks.
Thanks, Tara. That's a great way to end. So I'd just like to plug our conference in September. It's taking place in collaboration with Belfast, and one of our core themes is the environment. So we have the Lancet Countdown speaking, among others. That's taking place September 24th, 25th. And you can find more details on our website or in the chat box. So thank you very much to everyone for attending. I think it's hard to condense everything into 1 hour, but I think we really made a good start, and I'm sure you will all continue this discussion elsewhere in your work and at home. I'll hand over now to Hala for closing. Thanks very much.
Okay, thank you, Rosie, for moderating this webinar today, and thank you to all our speakers for sharing all these insights and thoughts. We hope to see you all again in one of our coming webinars. And also thank you to IDE for co-hosting this webinar with us. We look forward to more collaboration in the future. Next webinar will be about leaving no one behind, keeping up essential services for non-communicable diseases patients in Ethiopia during the time of COVID-19 response. If you have any questions in advance, please send them to our email. And thanks to our attendees for joining and interacting during the webinar. The recording will be available on our YouTube channels. And don't forget also to check our COVID-19 portal with the best and most updated information. Thank you, everyone, and stay safe and see you next week. Thanks. Bye.
Thank you.